Pulmonary rehabilitation is appropriate for any stable patient with a chronic lung disease who is disabled by respiratory symptoms.
At Riordan Rehabilitation, exercise, training, and aerobic exercises are used to develop and cater to your condition/disease process. The goal of attending rehab is to 1. Increase exercise capacity, ability, and frequency. 2. Decrease your shortness of breath. Any education for exacerbation identification is used to provide exercises to decrease amount of exacerbations and, in turn, decrease hospitalizations and the cost to you. Our main goal here at Riordan Rehabilitation is to increase your quality of life, your personal health, pulmonary measurements, and of course, your survival.
Advanced lung diseases often have a significant psychological and social impact. Also, may be more severe if patients are requiring supplemental oxygen. Anxiety and depression are both associated with a progressive lung disease and needs to be understood while making treatment plans within a multidisciplinary team. Participation in a rehabilitation program have shown to decrease anxiety, depression, while improving cognition. For this reason, it's equally important to focus on the psychological impacts of your disease. Breathing techniques are also discussed with the patient to help reduce anxiety and panic attacks. If needed, referrals are made to psychologists, which are included in the multidisciplinary team, to help the management of these comorbidities.
Here at Riordan Rehabilitation, we partner closely with local durable medical equipment supplier, Mazer Medical Equipment, to provide all of your home durable medical equipment needs. When you come home from our facility, we want to make sure that your transition is as seamless as possible, so we'll be able to provide you with home oxygen, such as a stationary concentrator or portable tanks, non-invasive ventilation, OPEP therapy such as the aerobica, as well as other equipment like nebulizers, home suction, and even mobility equipment such as hospital beds, walkers, and wheelchairs to help facilitate your recovery in the event that you are still feeling short of breath or having issues with aspiration and need to have your bed elevated or anything of that nature.
Patients require home-based pulmonary rehabilitation and need assistance from family members or friends who can be trained by our multidisciplinary team on health professionals in their own home environment. These home-based programs are a good and suitable option for those in pulmonary rehabilitations for everyday life. Our established home-based programs are effective, useful, simple, cost-effective, and practical. We educate and instruct the patients about the benefits and importance of adhering to their pulmonary rehabilitation program and developed treatment plan and care. Adherence to your personally developed rehabilitation treatment care plan can significantly improve your physical functioning. Involvement can decrease the role limitations due to your physical health, role limitations due to emotional health, emotional well-being, social functioning, pain, general health, and health change scores.
You can qualify for home oxygen equipment using the following groups. Group 1 requires a diagnosis such as COPD and has 3 different ways you can qualify. You can use a resting room air saturation of 88% or lower, or a PaO2 of less than 55 for daytime use. You can qualify for hours of sleep using an overnight oximetry study showing a desaturation on room air to 88% or less for at least 5 cumulative minutes during the study. You can also qualify for oxygen at exertion using a 3-step test, which includes a resting room air saturation, an ambulatory room air saturation that must show a drop to 88% or less, followed by an ambulatory saturation taken on oxygen that shows an improvement. Group 2 is for short-term qualification and is only good for 90 days before retesting is needed. For Group 2, you can use a resting room air saturation of 89 or a PaO2 of 56 to 59 with a diagnosis such as pulmonary hypertension or congestive heart failure. Group 3 includes people who have a condition proven to be improved by oxygen therapy but do not qualify under Group 1 or 2, such as cluster headaches, but a prescription from a licensed provider is still required for qualification.
Social workers within your multidisciplinary team help allocate appropriate discharge destinations depending on what you require, provide counseling and advice regarding benefits with your plans in mind, aim to improve your social support, as well as identify and provide available resources to support you and your family. Your rehabilitation nurse is there to provide day-to-day care, whether within maximizing your function throughout your rehabilitation process and provide you with your daily medication schedule. Speech therapists within the multidisciplinary team are there to assess and treat communication and swallowing disorders. They are there to help train vocalization, provide alternative devices for forms of communication, as well as provide education on swallowing. They are also there to advise food and liquid consistency changes to reduce the risk of aspiration and improve your swallow function. Your dietitian is there to assess, promote, and educate you and your family on your individual adequate nutritional needs based on your condition. They also aid in your food habits that can help reduce risk factors for your specific needs, as well as adapt and change food to ensure your safety here at Riordan Rehabilitation. Psychologists in your multidisciplinary team will help you develop and provide strategies for you and your family to manage situations and problems regarding your condition. They will also help assess your mental capacity and make a detailed assessment of your emotional, cognitive, and behavioral statuses. Therapist is there to address improvement in motor skills and mobility through exercise and training. They are there to help improve quality of life by improving your independence and levels of function, as well as assess your movement and posture abilities. Your occupational therapist within your multidisciplinary team is there to help work with you to get you back to doing your daily activities. They advise on appropriate equipment, aids, or adaptations to help improve your independence. They also provide information and education to resume your social participation, self-care, production, maintain family life, and leisurely interests. Respiratory therapist is there to provide education regarding your current condition and treatment plan and factors that may affect your condition, monitor your airway, and provide breathing exercises to relieve your shortness of breath, and instruct you on any airways clearance techniques to relieve condition discomfort and prevent further exacerbations, as well as make pharmacological recommendations based on your condition to improve your outcome. Have rehabilitation physicians. They have the overall responsibility for you and your care, as well as your team coordination. They are there to diagnose underlying pathologies and impairments, develop your treatment and rehabilitation and pharmacological plan, as well as monitor the current plan or care and adjust as your condition requires to optimize your outcomes.
Do you want your family here at this facility? Take them to Riordan Rehabilitation where they can better suit their needs, because this place is scary. Riordan Rehabilitation assumes no responsibility or liability for errors or omission in the content of patient care. The information contained in the center is provided as an as-is basis with no guarantees of completeness, accuracy, usefulness, or timeliness without proper identification or healthcare proxy. We do not provide healthcare information over the phone. We are not real rehab. Please do not send your patients here.